Assalamu alaikum. I hope you are well. Today my topic is Baastrup syndrome or kissing spine. Baastrup syndrome is also known as Baastrup disease or intraspinous bursitis. Syndrome was first diagnosed by Baastrup in 1933. Baastrup syndrome or kissing spine syndrome is most common medical condition of the vertebral column, where the spinous processes of the adjacent vertebra come in contact with each other, resulting in back pain. This is most common in the lumbar spine, but in rare cases, this is known to occur in the cervical spine also. Baastrup syndrome is often misdiagnosed and consequently treated incorrectly. Causes: Baastrup syndrome के नतीजे में होने वाली बैक पेन की वजह बुनियादी तौर पर मैकेनिकल है, as a result of adjacent spinous processes coming in contact with each other. Suggested risk factors: excessive lordosis, which result in increased mechanical pressure, abdominal obesity, repetitive strains of the interspinous ligament with subsequent degeneration and collapse, incorrect postures, traumatic injuries, stiffening of the thoracic spine or the thoracolumbar transition. Symptoms: Baastrup syndrome के most common symptoms हैं lumbar spine, low back pain. और ये पेन उस वक्त बढ़ती है जब आप अपनी बैक को एक्सटेंशन मूवमेंट देते हैं, और ये आप जब अपनी बैक को फ्लेक्शन मूवमेंट दें तो आपको अच्छा फील होता है, और जब आप अपने अफेक्टेड एरिया को हाथ लगाएं, टच करें तो आपकी ये पेन ज़्यादा हो जाती है. इन रेयर केसेस Baastrup syndrome affects the cervical spine. You may feel these symptoms in your neck. Baastrup syndrome की वजह से स्पाइन में डिजेनरेटिव चेंजेस आ जाती है, जिसकी वजह से आप स्कैंडी डिसऑर्डर सिम्टम्स फील करते हैं. फॉर एग्जांपल, आपके लंबर स्पाइन में स्पाइनल स्टेनोसिस हो जाती है, जो कि काज करते हैं न्यूरोलॉजिक सिम्टम्स सच एज रेडिएटिंग लेग पेन, नमनेस एंड वीकनेस. Baastrup syndrome को डायग्नोज कैसे करें? थेरेपिस्ट पेशेंट को चंद मूवमेंट करवाएगा जिसमें फ्लेक्शन एक्सटेंशन आ जाएगी, ये इसका फिजिकल एग्जाम होगा, और एक इमेजिंग टेस्ट करवाएगा जिसमें इंक्लूड है एक्सरे, कंप्यूटेड टोमोग्राफी एंड मैग्नेटिक रेजोनेंस इमेजिंग. X-ray may show the spinous process is making contact, but CT scan will better eliminate degenerative changes, for example, a herniated disc caused by the disorder. However, MRI is best suited to highlight area of degenerative changes involving the soft tissues of the spine and can detect kissing spine in its earliest onset. Your doctor may order a combination of imaging scans to get a complete picture of the affected area. Baastrup syndrome management. First one is medical management. Main goal to reduce low back pain as well as return to normal ADLS. Conservative or surgical. Localized steroid injection, inflammation changes or edema, and SAIDs analgesic. Extension movement of lumbar spine should be avoided. Injection of steroid and local anesthetics into the interspinous ligament. Surgical. Excision of the bursa, partial or total removal of the spinous process or an osteotomy. Interspinous spacer devices such as a X-stroke. Physiotherapy management. As alluded to, the main goal is the reduction of pain as well as hyperlordosis and to improve spinal function. Once the pain is managed, physical therapy management can be involving education, strengthening and stretching of the abdominal and spinal muscles. Treating the hyperlordosis is a key aspect, hence strengthening of the trunk muscle along with postural education and hip flexor stretches. When the abdominal muscles are weak, the hip flexors are mainly responsible in shaping the lumbar spine. Furthermore, the rectus femoris muscle is a continuation of the hip flexors, important to stretch these muscles. The hip flexors can become shorter through long-term sitting or resting. When these muscles shorten, it can affect the function of the gluteal and the spinal muscles. इन मसल्स को स्ट्रेच करने का तरीका: नी और अगले पाँव पे रेस्टिंग पोजीशन में वज़न डालें. ट्रंक को उस वक्त तक आगे की तरफ स्ट्रेच दे पुश करें जब तक कि आपको स्ट्रेच महसूस ना हो. ट्रंक को अपराइट करके रखें. इस पोजीशन को 20 सेकंड तक होल्ड करके रखें और इसे दिन में 5 से 3 दफ़ा रिपीट करें. Motion of the gluteus maximus muscles during the flexion extension cycle is decreased in patient with chronic low back pain, which is why strengthening of these muscles should be part of the physical management program. Physical therapy is also suggested to be helpful for reducing muscular damage that is provoked by the disease, and other treatments such as heat therapy, ergotherapy, and muscle relaxation techniques can be helpful.